Horses' teeth are really, really important because they eat a mainly forage-based diet that has to be ground into really small pieces to actually make it digestible. So without their teeth, a horse really can't survive. They're extremely important. A normal horse, you have the incisors at the front of the mouth. Those are for cutting grass and grasping hay. Then we have the canine teeth, which are present in most male horses and occasionally in female horses, also called the tushes. The wolf teeth are present in some horses, and we'll have a bit of a chat about them later. But the main teeth I want to focus on are the cheek teeth, which are the molars and the premolars, and they're the most important teeth in the horse's mouth because they do all of the grinding work. So we only see a small section of each cheek tooth actually present within the mouth. There's a huge amount of reserve tooth present, which is inside the horse's head and sit inside the sinuses, which we can see on an x-ray. So this is the top of the horse's head here. This is inside the mouth. This is a relatively young horse, and these roots are occupying a large part of the horse's head. As the horse ages, this root will get smaller and smaller as the tooth erupts throughout the horse's life. So the reason horses have this huge root and this continuous eruption of tooth throughout life is because they eat grass, and grass contains silica, which is quite coarse and grinds the teeth down at a rate of about 2 to 3 millimetres per year. Concurrently, horses will erupt their teeth, pushing out new tooth at a rate of also about 2 to 3 millimetres per year. So an adult mature horse will have about 75 millimetres of reserve crown. So these teeth should last a good 30 to 35 years. The horses actually do grind their teeth in a circular motion, eating on one side of the teeth at a time and then on the other side of the mouth. Sorry, using a skull is not the easiest way of demonstrating. Okay, so the teeth in a horse have enamel. This is the white line running round the outside of the tooth. That's the hardest part of the tooth, and that's which does the hard work of grinding the food. To increase the amount of enamel available for grinding, we have these folds of enamel ridging onto the actual surface of the tooth. Now these are normal enamel ridges that are present in the horse's mouth. So also in a normal horse, the teeth actually sit at a slight angle, with the top teeth sitting slightly angulated sideways, so that as the horse grinds and that enamel is worn away, we get edges, sharp enamel points forming on the outside of these upper teeth and on the inside of the lower teeth. So even a completely normal horse does need to have routine dental treatment to rasp away these sharp enamel edges. So, signs of disease, signs of problems within your horse's mouth. The most common sign you'll see in a ridden horse is discomfort from being ridden. Now those sharp enamel points can actually cut into the gum and cause significant amounts of discomfort, especially if the bridle is actually pushing the soft tissues down onto those enamel points. You can sometimes see some more subtle signs, like just leaning or preferring one rein over the other, which can be a sign of just discomfort when being ridden. Okay, more serious signs of disease are quidding. Now quidding means taking food into the mouth, chewing it up, but it will eventually become too painful to chew. The horse will actually spit that half-chewed piece of food out onto the ground, leaving these clumps of quidded food, which is half-chewed. Often you see that lying underneath the hay net or even over the stable door. It's much more common to quid coarser food like hay or haylage. Grass is much softer and easier to eat, so it's not usually seen to be quidded as much. If there's one particular area on your horse's mouth which is really, really sore, maybe one really sharp edge, you will often see a horse packing impacted food material around that edge, and you can see little hamster cheeks where they're pouching the food in. Weight loss, you usually only see weight loss in the latter stages of dental disease, when the horse has already presented some other signs like quidding or difficulty eating. But occasionally, weight loss is actually the first symptom you'll see. Because that food is being swallowed and it hasn't been properly ground into small enough pieces, it hasn't been digested properly, so they're not getting enough nutrients out of the feed. Other symptoms we'll see are halitosis, which is smelly breath. Choke, again caused by eating food that's not been properly ground up. It can actually get stuck in the esophagus and cause choke. Colic, in this situation I'm talking about impaction colic, where those longer fibres of food are getting stuck in the large intestine and are causing an impaction colic. Nasal discharge, if it's nasal discharge due to dental disease, often we'll see the discharge just out of one nostril as opposed to out of both, and it's usually really thick and cheesy and it really smells absolutely foul. So that's often a sign of dental disease. Not eating, a horse that suddenly stops eating altogether is a sign there's something really badly wrong. Often a fractured tooth will cause a sudden stopping of eating. A more subtle sign of dental disease is dunking their hay in their water. Now, a lot of normal horses will do this, but if your horse suddenly has started dunking its hay in its water, that may be a sign that there's something going on. Okay, I'm just going to run through a few common conditions. There's not time to go through everything, but I'll just go through a few of the more common ones. This is almost normal. This isn't really even a condition. This is just sharpened enamel points, which are actually, in this horse, starting to cut into the gum and actually cause ulceration of the gum. This is extremely common and is very easily treated using your rasp and pressing that rasp in between the tooth and the gum. You can see, to actually take this picture, somebody's used a speculum to push the gum out of the way, because that gum sits very close to the tooth. And with your rasp, you might actually even have to press onto that sore ulcerated area. That's why a lot of horses don't always tolerate having their teeth rasped, and we will have to use sedation. Sedation makes the job much easier for us and much more comfortable for the horse. Another common condition are hooks and rants caused by misalignments of the jaw. This is quite an extreme example, but this horse has severe parrot mouth. The top jaw is sitting forward of the bottom jaw, and this is obviously going to be affecting the alignment of the cheek teeth further back as well. So this first cheek tooth is sitting forwards of the tooth below it, so there's nothing to grind against it, although it's still erupting at that same rate, so it forms this large overgrown hook. Now, similar can occur concurrently with the lower jaw sitting forward of the top jaw, which is called sow mouth, and there you get ramps forming at the back of the bottom teeth. Although these examples are quite extreme, you can often get horses with really quite subtle overgrowth in their incisors and have quite large hooks sitting on their front teeth. So to treat these, we again, for small overgrowths, can just use the hand rasps and just rasp those down. But for larger ones, we can actually use these mechanised burrs. Just put it on and show you, and it can just burr away the tooth. We do have to be careful though, because the tooth does have a sensitive layer underneath. We can only take off a maximum of 2 to 3 millimetres at a time. So if you had a very large overgrowth, it may take 2 or 3 treatments to actually get that back into a normal position. Okay, diastemas are one of the most common conditions we'll see that needs a lot more advanced dental treatment. So in a normal horse, the teeth should be sitting flushly opposed to one another. If any gaps form, then food will become pocketed down in between the teeth. That food then starts to rot and cause gum disease, and as the gum recedes away, you've got a bigger space and more food becomes impacted in. Now, this can be exacerbated by exaggerated transverse ridges. So as I was saying before, it's normal to have small ridges of enamel, but they can become enlarged and actually force food down into the opposing diastema and make the situation much worse. Now, we do generally get 2 sort of vague groups of diastemas. Younger horses can get these developmental diastemas, and that's caused by inadequate angulation of the cheek teeth. So this first cheek tooth should be angled backwards, and this last cheek tooth should be angled forward towards the nose, pushing those cheek teeth all together so we've not got any gaps in between. So we're only really going to be able to assess these cases by taking x-rays off their head and seeing the angles of their cheek teeth. Now, your geriatric diastemas, these are a lot more common. You'll see these in older horses. As the root is erupted out and we've not got so much pressure, the teeth just gently start to drift apart and you get these gaps forming. Now, although developmental diastemas do cause a lot more problems than your geriatric ones, we do treat them in a very similar way. So first of all, we want to flush out all of this rotten food material. So we can use one of these modified garden pump flushers, which has got a little nozzle on it. We just poke that in and flush out all the food material. Sometimes we use little picks and probes as well and just get all of that food out. If we've got a diastema like this, where we've got a wider section down towards the gum and a narrower section up at the occlusal surface of the tooth, we can actually widen this section out using one of these drills. So we can attach that onto this mechanised burr and actually drill out the diastema. If there's a lot of quite nasty gum disease, we can also pop some antibiotics and a putty into the gap to pack it in and help that gum heal, and that gum will then also help to fill that space back in again. Okay, if a tooth is lost or is removed for any reason, the tooth opposing it will continue to erupt at this 2 to 3 millimetres a year. And if it's not treated, you can get these very large overgrowths forming. Also, if you've got a displaced tooth, if you have a tooth sitting towards the inside or the outside, the tooth opposite that won't be ground down properly and will become overgrown. So this needs regular maintenance to keep on top of these overgrowths. Again, either using our hands, tools if they're just small and we're just keeping on top of things, or like this horse, it's obviously not had dental treatment in years because you can see how large this overgrowth is, and it's actually starting to cut into the gums and the soft tissues of the mouth, causing significant discomfort. We might need to take our mechanised burrs and actually, over several treatments, get that under control. Now, fractured teeth are obviously very serious and often will cause a sudden stopping of eating or a sudden very severe quidding. We can get sometimes a fractured tooth where we just have a piece of tooth that we can remove and the rest of the tooth may continue to remain healthy. But often a large fracture will actually go into the sensitive parts of the tooth and you'll get infection tracking up into the root and causing a root infection. Now, occasionally you will actually see a tooth root infection in a horse with a very normal looking mouth. If you look inside its mouth, it may just have a very, very small hole somewhere tracking infection up. In these cases, all you might see is a swelling on the side of the horse's face or perhaps a snotty nasal discharge, but it's actually eating fine. And in these cases, we need to take x-rays to actually assess the roots and see which tooth is damaged. Once we've decided which tooth is affected, or if we can obviously see that in a fracture, we can actually remove the tooth. Now, this is just using a pair of molar extractors here, clamping onto the tooth and wiggling it out. This is obviously quite a big job, especially in a young horse that has a large root. Occasionally, if the horse has a very large root and is quite young, we may even need to give the horse a general anaesthetic and actually make a little hole in the side of their face and push the tooth out. But most of the time, we can remove them in a standing horse using these extractors. Okay, wolf teeth. Now, these teeth are not present in all horses, so they're a vestigial tooth. That means that the tooth is of no function to the horse. It has a very small root and it often sits just in front of the first cheek tooth. In various locations. It can sit round to the side, right in front, or right on the inside. Now, in this one, where it's sitting more towards the inside of the tooth, it probably won't impede on the bit and probably won't cause too much of a problem. This cheek tooth, however, this wolf tooth, however, is sitting forwards of that cheek tooth, and the bit is going to hit right onto here, and it's going to cause quite a lot of discomfort with the bridle. So we often will remove these, especially if they're seen in a young horse prior to backing. If it's sitting forwards of the first tooth, we'll get that out before the horse has a bit in its mouth and associates the bit with discomfort. Now, these teeth do have a reasonably small root. They're not nearly as difficult to take out as the cheek teeth, and we can take these out again standing. We can just, we don't have the tools here, but we can just use these tools to remove the cheek teeth without usually too much bother. Okay, now what happens to horses in the wild? Obviously, they don't have dentists, so how do they cope? Well, there's a couple of things. First of all, they're not ridden now, so obviously those sharpened enamel points down the sides, they don't really bother them that much because they're not having a bridle pressing the soft tissues onto those sharp edges. Also, their feeding habits. They eat in a much more natural way. They're eating coarser food, they're eating a much wider variety of different plants, and they have their head down. So you do tend to see more even wear on the teeth, and you don't tend to see those little hooks forming. That's another thing, that if your horse is having these little hooks, if it's got its head up, that can often alter the actual position of the back teeth. And if it has its head down eating with its head down on the floor, that can often be a more natural chewing position. Now, natural selection plays a huge part. These wild horses, if they're born with serious dental problems, there's nobody there to treat it. The horse won't survive and won't pass its genes on to the next generation. Whereas in domestic horses, horses are bred for many other traits, including appearance or height or speed, and are not often bred for traits such as their dentition. So a horse with bad teeth can often be bred from. So over the years, you find natural selection selects for horses with good teeth. Now, the geriatric dental problems that we see in domestic horses do also apply to wild horses, which is why, unfortunately, wild horses just don't live as long as domestic horses, because once these problems start to occur, they just don't survive. So let's just go on to our last slide. The thing to really remember is horses are prey animals. They don't like to show outward signs of pain or discomfort, and they will often suffer in silence for quite a long time before telling you they've got a problem, which is why it's very important to have regular routine dental checkups so we can pick up on problems early and get them sorted before they're in too much pain and discomfort.